Everybody heard that? So across the country, independent physician groups are having a hard time staying alive, especially oncology, because of the cost of cancer drugs and a number of other economic factors. A lot of these physicians are finding novel ways, I don't like it, but they're finding novel ways to be able to partner with hospitals in their communities so that they can make enough to make a living as a physician, pay off their student loans. You know how this goes, right? And then still practice medicine, but in a lot of communities across the country, these systems, these independent physician groups are being swallowed up. Do you know what the dangerous part of that, what the dangerous message is in that? It takes away some competitiveness in the community, right? You should be able to go get your cancer treatment wherever you want. A lot of my brothers and sisters are Presbyterian, another one that doesn't leave the room, all know, is that Presbyterian healthcare services, are they irritated at us generally most of the time? Yeah, because providing outpatient cancer treatment is cheaper than providing inpatient hospital treatment. And you can go look that up on the internet yourself. It's much less expensive for you as a patient to get your treatment there in an outpatient setting. They also don't want you to know that we're contracted with every single payer in the state of New Mexico. That gets on their nerves, but we are. And Dr. McEnany negotiated that contract, thank God, years before me. But it was one of the things that we used to fight about all the time when I managed her contract. And then she hired me. All right. So, working for Dr. McEnany, she's great. 57% say practice acquisitions is a doctor recruitment strategy. It is. Physicians aren't always necessarily good with business. Some of them, not all those doctors out there are like Dr. McEnany and Dr. Fontaine. Dr. Fontaine has an MBA. Not all doctors think like that. What do doctors think? I want to treat my patients, of the 30 to 45 of them you make me see every day, depending on what specialty I'm in. And then I want to go home to my family. And that's what they want to do. So strategies being used by hospital systems to recruit physicians, that's one of them. 55% say they want to maintain a competitive edge, you can see that. And 30% are acquiring practices as part of the accountable care strategy. 30% are acquiring practices as part of the accountable care organization strategy. Because there are a lot of indicators for under Obamacare and under the Affordable Care Act to make sure that we are managing costs. There are measures upon measures upon measures. And they were reporting all of this data to CMS, and CMS is in return managing that data to see where they can cut costs. Right? They're dealing with a lot of fraud. You see that in the paper every single day. And so that's something that they're dealing with. And they're dealing with, just the cost of doing healthcare nowadays. We overtreat. Do we overtreat? A lot of times we do. Because why? Because the physicians are managing risk. That's what they're doing. Health insurance companies. If you can prove value to the payers, will they increase your reimbursement rates? Here's another little story. You guys are learning a lot today that doesn't leave the room. You guys are going to have to go tip on all of your mouths, but it's going to be great. So when I first went to go work with Dr. McEnany, wanting to work back in a clinical setting, we wanted to see how we were measuring up as far as a clinic was concerned. And so we also wanted to increase our reimbursement rates. Physicians want to increase their reimbursement rates. Here's one reason. Did you know that our physicians, recruiting is a difficult thing here in the state of New Mexico. Did you know that physicians can go to West Texas and make $60,000 more working in West Texas than they can working here in New Mexico? Do you know why? Their RBRBS, this is the stuff of acronyms, right? Their relative value, blah, 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 fee schedule that's set by CMS is set in different ways in different states.
What's CMS?
The Center for Medicaid and Medicare Services. They manage the Medicare reimbursement. And they set the standard for Medicaid reimbursement in most states. So that they set the standard. But they also set the standard for reimbursement to physicians. So there's only so much sunshine you can sell, right? And you have to be able to sell to schools. And if there's a spouse, you have to get the spouse employed. I mean, it just goes on and on what we're trying to do to keep physicians employed and keep them coming here to the state of New Mexico.
So it was a little skewed. I thought it was more because the other cities, other states, has a larger amount of the population have their own insurance and not Medicare.
I follow you with that. I think I agree with you also. I think that what's happened is that in New Mexico, we have a diverse payer system. I've looked at other states where they have a one-payer system, and it's really difficult for them to manage. I mean, how are you going to go negotiate a contract for higher reimbursement in a state where there's one payer? That's really difficult for physicians when you're trying to create a competitiveness, right? But luckily in this state, that's not the case. Some of the payers pay higher, some of the payers pay lower, depending on the volume of patients that they have signed up. We're up in open enrollment season right now, right? You're going to go and you're going to pick your new payer and you're going to try to figure out who has the best benefits, and you're either going to stay with your current provider or you're going to move. And a lot of that, of course, you're going to put pressure on your employer groups to go out and pick a different system or not. Did that answer your question, or did I completely evade the question? I wasn't sure.
No, I wasn't asking a question.
You're just kind of stating a fact. Okay, I appreciate that. More facts, keep them coming. Keeping patients out of urgent care's emergency rooms and lowering hospital admissions saves healthcare dollars.
Yeah.
I think that that's incredibly true, and I'm going to touch on that a little bit later as far as a grant that Dr. McEnany applied for this last couple of years ago, about 2 years ago. Again, who are your strategic partners in the community referring physicians? Family, general, internal med, with diminishing numbers. We don't have, I think I went with Dr. McEnany to Ann Arbor, Michigan about 3 years ago, and she asked 500 residents that were paying their AMA dues. Oh, my boss, sorry. Dr. McEnany just stepped off as the chair of the American Medical Association, which is a big deal because that's a national position. And then in 2 years, she's going to run for president of the AMA, and I will be sucking my thumb on my desk because that's a big campaign. But that's kind of how she rolls, and she's amazing. But we were talking to those 500 physicians paying their AMA dues in Ann Arbor, Michigan, and we asked that group of people how many of them were going into family practice, general practice, or internal medicine. How many in the room do you think of those 500 raise their hands going into that specialty? Not one. Not one. In a state like New Mexico, who do you think is practicing medicine in most of the rural and frontier areas of our state?
PAs.
We're moving in that direction, but they're still not out there yet. You know where PAs and nurse practitioners want to live? Here. And I know that from the days that I was doing contracting. Most of those.
School system.
Right. And so there's some things that need to be changed in the way that we incentivize those providers. But I can tell you that we're up against it. So then you get the Affordable Care Act, the Accountable Care Act, and you get all this stuff in place. And then we added 100,000 more people that can be insured in the state of New Mexico. And then the number of physicians is dwindling as far as those that are referring to specialists like us. And we're dependent on those physicians to help us with some of the pain management with our cancer patients across the state. So there's a lot that goes in, that's involved with that. Our partners in urology and derm GI surgeons, they're all referring to us, and I manage those relationships myself, and I'm out there all the time, shaking hands, buying chocolate, little tiny cans of chocolate, so you guys don't think there's anything going on. But really, and they're very grateful, but mostly they just want you to be nice to them, and they want you to do what they ask you to do, and they want the information back from their patients. That's how they measure quality in their office. Tell me what's going on with my patient, and then you've built a relationship with the physician. Managing these relationships, I do it all the time. Patients and families, they're my biggest advocates in the community. We treat them the best we can treat them. Every single time, sometimes we drop the ball. Do I eat a lot of crow? I have feathers coming out of every part of my body. But I'm telling you, I mean it from my heart, and so does every patient, so does every employee there at the cancer center. They come to me knowing that I'm not going to go to them in a punitive way and tell them you messed up. I'm going to go to them and say, how can we have done that better? How can we make it better? That changes quality. When you go to your employee and you work out a resolution, that changes it, and that makes the difference. And that makes the difference for every time a nurse in triage, an operator on the phone, an employee at the front desk interacts with that patient the next time, because their boss isn't lording over them. You got to love them as much as you love the patient. So here we go. Survival of the fittest. Urban, rural, frontier doctors, we've talked a lot about this, but I'm going to just kind of knock these out. Escalating costs, complex regulatory environments, maintaining referral streams with your referring physicians, national recruiting efforts, we talked about that, community cultural competence, making sure your doctors know